What is contact tracing? Well, it means making sure that you get notified if you've had contact with someone who has tested positive for COVID-19, so you can do what's necessary to keep you and your family and your community safe. Contact tracing means we will let people know before symptoms start that they could become ill. In the context of a very infectious virus, this is our primary tool for identifying potential asymptomatic spreaders so that they can self-isolate quickly and slow the spread of the virus to their contacts, keeping more people COVID-free for longer. And that last factor is key because it demonstrates why contact tracing is so important to all of us together. It means a reduced rate of spread, fewer outbreaks, and an all-around healthier Illinois. Contact tracing isn't a new concept. It's been around for many years. The difference now is that in order to move safely back toward normalcy, Illinois, the United States, and frankly the whole world must contact trace on a never-before-seen scale. Contact tracing has played a role in our COVID-19 response since the earliest days of this pandemic, as local health departments around the state have aggressively sought out each COVID-positive person to identify all their close contacts and then encouraging those contacts to opt into monitoring programs and to follow recommendations. That was when we had a manageable number of cases and contacts that county health departments' existing staffs could handle. Of course, as we all know, over just the last few weeks, COVID-19 has reached a massive scale of spread statewide and nationwide, and existing public health management infrastructure simply can't keep pace. Here in Illinois, we've had more than 50,000 known cases to date, largely in just a 60-day time frame. Their contacts are 50,000 sets of family, friends, coworkers, commuters, classmates, and other contacts. It's an unprecedented public health challenge, so we need an unprecedented solution to meet this moment. To do that, Illinois will be building on our existing infrastructure and expertise to shape a massive statewide contact tracing operation, gradually building over the coming weeks, and then scaling up an army of contact tracers by the hundreds and then by the thousands. Right now, based on our current rates of spread, we're looking at a benchmark that could approach 30 workers per 100,000 residents. But to be clear, that number can and will diminish if we see greater success in our public health measures, particularly our new face covering requirement. Already, we've identified groups of Illinois residents quickly willing to scale and be part of our efforts: undergraduate and graduate students, volunteers, retired health professionals, local health officials, community health workers, and new hires. And if you're interested in being a part of that, keep an eye out for more information on how to get involved in your community in the coming weeks. A significant part of this program involves technology. When an individual tests positive for COVID-19, a contact tracer will reach out to them through an app, through email, a text, or a phone call. And because not everybody can or will use technology, some will require follow-up even with a safe in-person visit if the COVID-positive person can't be reached in some other way. Then step 2. Interviewing the COVID-positive person, asking them to gather their contacts and retrace their steps over the past 14 days. This is what allows us to significantly slow the spread of the virus, because connecting with those who've been exposed allows us to do 3 important things. 1, notify them that they've recently been in proximity of someone who has tested positive. 2, recommend that they seek a test and self-isolate. And 3, offer them resources on how to access any needed assistance to prepare them for self-isolation, things like alternative housing, food delivery, or medication. Privacy is an important aspect of maintaining trust in contact tracing. So to be clear, contacts will remain anonymous. Looking backward and pointing fingers doesn't help anyone in this situation. It's about what we do next to keep each other as healthy and safe as possible.